It's exactly 4:30. Good to have you with us here on eNCA. Our panel discussion this afternoon all around the death toll from cholera in Hammanskraal. It's a devastating story. As you can see, bottom of your screen, it has risen to 17. So here's the background and where we are at the moment. The Gauteng Health Department saying 67 patients currently in hospital, all of them dealing with gastro-intestinal infections. Urgent action, we're told, is going to resolve this crisis. But it's the blame game that has already begun. The question is, does the blame game get us anywhere? Tshwane Mayor Celia Brink is blaming the deteriorating infrastructure on previous administrations, saying if upgrades had been done sooner, the area wouldn't be experiencing this particular issue. Be that as it may, here's where we are today. 17 people have lost their lives. Professional engineer and visiting adjunct professor at the Wits School of Governance, it's Professor Mike Muller, along with Ferrial Adam, the executive manager of WaterCAN. It's an initiative of the organisation Undoing Tax Abuse. You'll know the acronym, of course, that being OUTA. Both of you joining us this afternoon, and a very good afternoon to you, and I appreciate your time. Ferrial, allow me to start with you if we can, and I use that term loosely. WaterCAN, what exactly is that? And then I'll ask the Prof to give us the insights on this. Hello, Ferrial. How exactly are you involved?
So good afternoon. So WaterCAN, as you mentioned, is an initiative of the organization Undoing Tax Abuse. And the CAN stands for Citizen Action Network. And we're trying to build citizen science activism around the country to test water. And we've been doing that for some time, for about a year and a half. But OUTA has had a role to play in the Hammanskraal crisis dating back to about 2018.
And Professor Muller, you wear two hats in this one. I'm fascinated to get your thoughts on this because not only are you a visiting adjunct professor of governance at Wits, if I understand correctly, but you're also a professional engineer. So I imagine you're looking at the engineering perspective where the failures were there because it's systemic. And now, from a governance perspective, there's also a failure on this as well. Which hat would you like to start with?
Oh, I don't know, Gareth. Good afternoon to you and to Ferrial as well. Greetings. I think we are at the end of a very, very long story. This hasn't started, this year or last year. It's actually been going on for a couple of decades, ever since Botswana was encouraged and allowed to build a water treatment plant a few kilometers downstream from a sewage plant, which is really not a very good idea. The point is that that situation arose, even before 1994, but it hasn't been fixed ever since. I think we need to think about the cholera and actually what we know about cholera. And at the risk of confusing your listeners and viewers, I just remind people that cholera doesn't necessarily get transmitted by water. Cholera is a disease of poor sanitation and just general inability to look after yourself and keep a clean surroundings and a healthy lifestyle. And what's happened in Hammanskraal, because the water situation has been so bad, there hasn't been enough water essentially for people to live a clean and healthy life. And in a situation like that, cholera can come in, and it usually does come in, by bus from a visitor from somewhere else where there is cholera. And once it gets into the community, it spreads. And I fear that this is what's happening in Hammanskraal. The conditions for the spread of a disease like cholera have been created by the water shortage, by the poor quality of water that's been offered. The fact that the municipality told people, don't drink this water, what are they supposed to drink? Yeah. And as a result, there was not enough water for people essentially to look after their own sort of sanitation and health. And that creates the conditions where we've now seen 17 people die. And we need to talk about the health consequences and implications of that, because if 17 people have died, Gareth, it means that probably 1,500 people have been infected, because usually the death rate is very low. Either a lot of people have been infected and we haven't heard about that, or the quality of healthcare has been very bad in this case. And there's so many people who need to answer on what's going on and why proper action hasn't been taken earlier. It's almost impossible to know where to start, frankly.
Yeah, it really is, and I couldn't agree with you more. Where do we begin on this, Professor? And I'm going to come back to you on, could this have been stopped perhaps a long time ago? You say this has been around for decades, if not longer. I'm going to come back to you on that. And Ferrial, I see you nodding your head, and allow me to link either correctly or incorrectly. You tell me. When we're talking about tax abuse, the fact that the infrastructure has failed so badly, to the Prof's point, that the infrastructure is not well managed, it's been badly handled the past few years, that's because taxpayers' money has not been used for what it's meant for. You agree or disagree with me?
So I agree with you. That is a case in point. I mean, we're seeing that around the country where wastewater treatment works are failing because the right amount of budget for infrastructure and for maintenance is not being spent. So we're having that issue, and that is exactly what's happening with Rooiwal. To add to that, in 2015, 2018, there was funds allocated to fix the situation when the South African Human Rights Commission was involved. And we don't know if any of that fixing happened, if the repairs were done, but we're finding ourselves in the same situation. I just want to add, in terms of what Prof said, I do think that while cholera can be transmitted, it's very contagious, he's right. It can be transmitted through food, but also water. And in this regard, where you have a Rooiwal wastewater treatment work, which is completely failed, I think that you are going to have high levels of sewage. And with sewage pollution, you can link things like E. coli and other kind of diseases such as hepatitis and cholera.
And Ferrial, I want to stay with you for a moment because I know how outspoken OUTA has been about the blackouts, about e-tolls, etc., etc. Here's what concerns me the most, and Prof, I can ask you this when I come to you in a moment as well. Ferrial, I stay with you though. Water is the most basic of human rights. I mean, there are obviously others. There's education, there's safety, and I can go on. But water is probably the most basic. First of all, the government has gotten our electricity crisis completely wrong. We knew about this decades ago. And now I get a sense, perhaps I'm panicking, but I get a sense they're not in charge of our water as well. This is a bit of a doomsday scenario, is it not?
So I wouldn't go to doomsday, but I do think that there is an urgency. And if we look at government's own green drop and blue drop reports that they released last year, and we're waiting for the new ones, maybe Prof can tell us when they will be released, but it doesn't paint a very good picture in terms of how we're faring with both our water treatment plants as well as our wastewater treatment works. So that is a concern, and I do think that given that water is basic human right, but also we need water to survive. And so I think that we need some urgency in terms of how we're dealing with the water across the country.
Prof, let's talk about that urgency for a second. You highlighting a little while ago in your opening response that this has been around for a while. This hasn't exactly caught anybody off guard. Could this have been prevented? If it could have, when could that have been prevented? Celia Brink, Tshwane Mayor, saying it's the previous administration. The previous administration saying it's the current administration. Realistically, you're a professor, you're an engineer. When could this have been prevented, do you think?
Okay, well, we can start in 1980s when they built a sewage works upstream from a water treatment works, which was supposed to supply people, immediately creating a risk. And we could have done it, intervened a few other times when Rand Water offered to provide water to Hammanskraal directly, partly to sort of avoid these kind of problems. So there have been numerous opportunities. The city itself, because, the city, remember, the one good piece of news about this is we don't depend on a single water supplier right across the country like we depend on Eskom for electricity right across the country. So individual municipalities quite often don't like to get water from someone else. They would like to control the money and the way the money is used to provide the water. And it's what happened, by the way, in Gqeberha with Nelson Mandela Bay running out of water. They knew what they needed to do, but they would have had to spend money outside of the city and pay other people to provide the service. And they refused to do that until we've had this drought crisis in Gqeberha. So we don't have individual big problems like an ESCOM in water, but what we do have is lots of municipalities who, frankly, the politicians seem to have forgotten what their job is. Their job is to create the conditions in which people like myself, professional engineers, public servants can get the money they need to run the services properly and make sure people get the water safely that they need. And, the politicians do now seem to have lost the plot. They do seem to think that actually if there's a budget, it's for them to decide where to spend it and why to spend it, and the services must wait. And, we really can't afford that kind of attitude at the political level. And all we can hope for at this point is that we now begin to see some kind of discipline imposed on municipalities like Tshwane to use the resources they have properly, and if they don't get to use those resources properly, they need to be taken away and given to another organization. Let Rand Water get the money to run, to supply the water to Hammanskraal, and perhaps that would improve the situation. But this is a political failure, and I think the parties can blame each other. And I've heard both saying that it's the other's fault. I would label this as a failure of the political class to deliver the services that they're elected and funded to provide.
And Ferrial, I see you nodding. I imagine you agree with this as well. The question is now, and I bring in the dirty C word, coalitions. No one seems to be able to actually be in power long enough in any of these metros to do exactly what the prof is saying. Get on top of it. Get on top of the program. Get the budgets in place. Today already, the MMC for finance in Tshwane can't get through a council meeting, and people are dying in Hammanskraal. How does OUTA suggest we fix this if, as the prof says, this is a political issue, but it's costing lives?
So in terms of the political issue, you're completely right, and I agree with the prof as well. What we're saying is that the finger pointing can go on, and political games are being played. There's no time for that. We're saying that it doesn't matter whether it was this mayor or the previous mayor or the previous municipal manager. This issue has been going on in Hammanskraal for more than 15 years. And so we're saying that there should be retrospective charges against people, not the municipality. I think until we hold people accountable, where people are charged criminally for pollution and not doing their jobs, they need to lose their jobs. This kind of situation is not going to change, and we are going to see more and more of it around the country. We are already, maybe not cholera outbreaks, but we are seeing failing wastewater treatment works around the country. And people need to be held accountable. You can't be in a job where you are still spewing 50,000 litres of sewage into the rivers every day.
Ferrial and the prof, I'm going to ask you both a last question, just very briefly from both of you. Ferrial, allow me, if I can come back to you for a second. What we seem to see is when governance and politicians, mayors, councillors, MECs, I can keep going through the acronyms, when they get something wrong, they're reshuffled. People have lost their lives here. Should somebody not be in jail because of what's happened?
That's exactly what we're saying. We are saying that the buck has to stop with someone. Someone needs to be charged for the loss of lives. And I think also, we're focusing on local government, but I think that national government also has a role to play here in terms of the Department of Water and Sanitation. The minister said that they've been regularly testing the water at Temba Water Treatment Plant and that it hasn't been fit for drinking. Why has that not been made more public? We want to know that if they're testing, why not share the water testing results? If they're supposed to do that, but we don't have that. And I do agree. I think bottom line is someone should land up in jail for what is going on in Hammanskraal. We've lost people's lives.
Ferrial Adam, thank you very much. Stay where you are for the moment. As I say, thank you also to the Professor, Mike Muller. Last comment from you, Prof. Would it be too far to suggest we see politicians in jail when people die? Last brief comment from you.
I'd like to see more attention given to meeting the needs of the people in Hammanskraal. Make sure that no one is short of water to drink, to cook, to wash, to keep clean and stay healthy. And really, if we're going to put our energies anywhere, I'd save the money on the lawyers and I'd pay to get the pipes working and to get the water into people's houses. We really need to put people first in this discussion and let's fire the politicians. Let's take the job away from them. Let's give the job to somebody else. But let's concentrate on getting the water that's clean and safe and that people need and getting it to them regularly and reliably. I think that should be the priority. And the big punishment will be to take away all the perks and all the salaries and just say to them, sorry, you haven't done the job. We've given it to somebody else. You better find something else to do, because it's unacceptable that we have politicians paid well and people not getting water. That's not what they're there for, and we shouldn't allow it to continue.
It's also not what taxpayers are paying for. Professor, I thank you very much indeed. As well, Ferrial Adam, thank you. I see you nodding, and of course you agree, I'm sure, with what the professor had to say in closing. Ferrial Adam from WaterCAN, an initiative by OUTA, and also Professor Mike Muller joining us this afternoon. He is an adjunct, a visiting adjunct professor at Wits School of Governance and also a professional engineer joining us on today. My thanks to both of them for this afternoon. Wonderful insight, and I wonder if any of the politicians are going to be listening. As the prof says, put the people first. It's just simple clean water. It can't be that hard.